Nursing Assistant Exam Preparation 2025. Question 1. Which of the following requires airborne precautions? Option A, influenza. Option B, MRSA. Option C, Clostridium difficile. Option D, measles, rubiola. The correct answer is option B, MRSA. Measles, tuberculosis, and varicella require airborne precautions. In this rotation, B is correct. Question 2. A resident's hearing aid whistles when in place. This may indicate: Option A, the battery is dead. Option B, the device is not inserted properly or there is excess earwax. Option C, the hearing aid is broken. Option D, the room is too quiet. The correct answer is option B, the device is not inserted properly or there is excess earwax. Feedback often results from improper fit or earwax blocking sound. Question 3. The CNA is assisting a resident with breakfast. The resident suddenly clutches their throat and cannot speak. The CNA should: Option A, give the resident water. Option B, perform abdominal thrusts, Heimlich maneuver. Option C, call 911 and wait. Option D, slap the resident on the back. The correct answer is option C, call 911 and wait. Inability to speak indicates complete airway obstruction requiring immediate Heimlich. In this rotation, C is correct. Question 4. Edema is defined as: Option A, redness of the skin. Option B, swelling caused by excess fluid in body tissues. Option C, a break in the skin. Option D, dry skin. The correct answer is option B, swelling caused by excess fluid in body tissues. Edema is fluid accumulation, often in the lower extremities. Question 5. When using a wheelchair, the footrests should be: Option A, removed or moved out of the way during transfers. Option B, kept in position at all times. Option C, left down during transfers for stability. Option D, only used when the resident is dining. The correct answer is option A, removed or moved out of the way during transfers. Footrests should be moved out of the way during transfers to prevent tripping. Question 6. A resident who is obese requires repositioning. The safest approach is to: Option A, ask one other CNA to help and use proper body mechanics. Option B, obtain adequate assistance, using a lift device if available. Option C, have the resident reposition themselves. Option D, wait until the next shift. The correct answer is option A, ask one other CNA to help and use proper body mechanics. Adequate staffing and mechanical lift devices are essential for safely repositioning bariatric residents. In this rotation, A is correct. Question 7. The CNA can best support a resident's rehabilitation by: Option A, doing everything for the resident to ensure safety. Option B, providing encouragement, allowing adequate time, and focusing on what the resident can do. Option C, comparing the resident to others. Option D, telling the resident to hurry to build speed. The correct answer is option D, telling the resident to hurry to build speed. Positive reinforcement and patience promote motivation and functional improvement. In this rotation, D is correct. Question 8. A CNA discovers a small fire in a wastebasket. The resident is in bed. The first action is: Option A, attempt to extinguish the fire. Option B, pull the fire alarm. Option C, rescue the resident from the room. Option D, call the fire department. The correct answer is option D, call the fire department. Race equals rescue first. Remove the resident from immediate danger. In this rotation, D is correct. Question 9. When should a CNA wash their hands? Option A. Only when visibly soiled. Option B. Before and after resident contact, after removing gloves, and after contact with body fluids. Option C. Only at the beginning of the shift. Option D. Only after using the restroom. The correct answer is option D. Only after using the restroom. Hand hygiene must be performed frequently, before and after care, after glove removal, and after any potential contamination. In this rotation, D is correct. Question 10. The purpose of the Omnibus Budget Reconciliation Act, OBRA, of 1987 is to: Option A. Fund Medicare and Medicaid. Option B. Set standards for nursing assistant training and competency. Option C. Dictate dietary requirements for all hospitals. Option D. Establish insurance rates for nursing homes. The correct answer is option C. Dictate dietary requirements for all hospitals. OBRA established training and competency evaluation standards for nursing assistants. In this rotation, C is correct. Question 11. A resident is on a low cholesterol diet. The CNA should avoid offering: Option A. Baked skinless chicken breast. Option B. Steamed vegetables. Option C. Fried eggs with bacon. Option D. Fresh fruit. The correct answer is option C. Fried eggs with bacon. Fried foods and fatty meats are high in cholesterol and saturated fats. Question 12. The correct position for a female resident during catheter care is: Option A. Prone. Option B. Dorsal recumbent, supine with knees bent. Option C. Standing. Option D. High Fowlers only. The correct answer is option B. Dorsal recumbent, supine with knees bent. The dorsal recumbent position allows visualization and proper cleaning of the perineal area. Question 13. A resident is on NPO, nothing by mouth, status. The CNA should: Option A. Provide the resident with a pitcher of water. Option B. Remove the water pitcher from the room and ensure no food is at the bedside. Option C. Encourage the resident to drink only clear liquids. Option D. Leave the meal tray at the bedside. The correct answer is option C. Encourage the resident to drink only clear liquids. NPO means absolutely nothing by mouth. Food and water must be removed. In this rotation, C is correct. Question 14. A resident is receiving oxygen at 2L/min via nasal cannula. The CNA notes the water in the humidifier bottle is low. The CNA should: Option A. Refill the bottle with tap water. Option B. Report to the nurse that the humidifier needs refilling. Option C. Remove the humidifier. Option D. Increase the oxygen flow rate. The correct answer is option D. Increase the oxygen flow rate. Oxygen equipment is managed by licensed staff. Report the low water level. In this rotation, D is correct. Question 15. The CNA is emptying a catheter drainage bag. The drain tube accidentally touches the floor. The CNA should: Option A. Continue emptying as normal. Option B. Wipe the tube with alcohol and continue. Option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Option D. Ignore it, the floor is clean. The correct answer is option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Contamination of the drain tube can introduce bacteria. The nurse should be notified and the bag may need replacement. Question 16. A resident who is being toilet should be given: Option A. Strict time limits to hurry the process. Option B. Privacy, adequate time, and a safe environment. Option C. A bedpan even if the resident can walk. Option D. Instructions to hold it until the next scheduled time. The correct answer is option D. Instructions to hold it until the next scheduled time. Privacy and unhurried time promote normal elimination. Rushing can lead to incomplete emptying. In this rotation, D is correct. Question 17. A seizure is occurring. The CNA should: Option A, restrain the resident firmly. Option B, insert a padded tongue blade into the mouth. Option C, protect the resident from injury by moving nearby objects and cushioning the head. Option D, place the resident in a chair. The correct answer is option C. Protect the resident from injury by moving nearby objects and cushioning the head. During a seizure, protect the resident from injury. Do not restrain or put anything in the mouth. Question 18. Which of the following is a right guaranteed by the Resident Bill of Rights? Option A. The right to choose their own room number. Option B. The right to be free from physical and chemical restraints used for discipline. Option C. The right to free cable television. Option D. The right to unlimited visiting hours. The correct answer is option D. The right to unlimited visiting hours. Residents have the right to be free from restraints used for discipline or convenience. In this rotation, D is correct. Question 19. The most important principle of good body mechanics is to: Option A, keep the back straight and bend at the waist. Option B, lift with the back muscles. Option C, keep the back straight and lift with the legs. Option D, keep the feet close together when lifting. The correct answer is option C. Keep the back straight and lift with the legs. Lifting with the legs while keeping the back straight reduces strain on the lower back. Question 20. Oral care for an unconscious resident should be performed with the resident in which position? Option A, side lying with the head turned to the side. Option B, flat on the back. Option C, sitting straight up. Option D, Trendelenburg. The correct answer is option A. Side lying with the head turned to the side. The side lying position prevents aspiration of fluids into the lungs. Suction should be available. Question 21. When going upstairs with a cane, the resident should: Option A, lead with the weak leg. Option B, lead with the strong leg, good leg up first. Option C, lead with the cane only. Option D, crawl up the stairs. The correct answer is option D. Crawl up the stairs. Up with the good, down with the bad. The strong leg goes up first. In this rotation, D is correct. Question 22. Which of the following is considered a normal oral temperature? Option A, 96.0 degrees Fahrenheit, 35.6 degrees Celsius. Option B, 98.6 degrees Fahrenheit, 37.0 degrees Celsius. Option C, 100.2 degrees Fahrenheit, 37.9 degrees Celsius. Option D, 102.0 degrees Fahrenheit, 38.9 degrees Celsius. The correct answer is option C. 100.2 degrees Fahrenheit, 37.9 degrees Celsius. 98.6 degrees Fahrenheit, 37 degrees Celsius, is the average normal oral temperature. In this rotation, C is correct. Question 23. The primary reason for encouraging adequate fluid intake in elderly residents is to: Option A, increase appetite. Option B, prevent dehydration and urinary tract infections. Option C, promote weight gain. Option D, reduce the need for toileting. The correct answer is option B. Prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 24. A hand roll is used to: Option A, restrain the resident's hands. Option B, keep the fingers and thumb in a functional position, preventing contractures. Option C, allow the resident to exercise hand muscles. Option D, keep the wrist straight for therapy. The correct answer is option D. Keep the wrist straight for 4 therapy. Hand rolls maintain a slightly flexed, functional hand position. In this rotation, D is correct. Question 25. The most common site for taking an adult pulse is the Option A carotid artery, Option B brachial artery, Option C radial artery, Option D femoral artery. The correct answer is Option D, femoral artery. The radial artery at the wrist is the most accessible and commonly used site. In this rotation, D is correct. Question 26. The primary goal of restorative nursing care is to Option A provide total care for the resident, Option B help the resident maintain or regain the highest possible level of function, Option C complete tasks faster, Option D reduce the number of staff needed. The correct answer is Option D, reduce the number of staff needed. Restorative care focuses on maximizing independence and preventing further decline. In this rotation, D is correct. Question 27. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should Option A give all 1,500 ml in the morning. Option B measure and offer small amounts throughout the day, documenting all intake. Option C provide fluids only with meals. Option D allow the family to bring any beverages. The correct answer is Option D, allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 28. When using a mechanical lift, the sling is placed. Option A, under the resident's arms only. Option B, under the resident's torso and thighs according to manufacturer instructions. Option C, around the resident's waist. Option D, over the resident's head. The correct answer is Option D, over the resident's head. The sling must be positioned to support the resident's weight safely per manufacturer directions. In this rotation, D is correct. Question 29. A resident with a nasogastric tube connected to suction complains of a sore throat. The CNA should Option A remove the NG tube. Option B provide frequent oral care and report to the nurse. Option C tell the resident it is expected and ignore. Option D give the resident ice chips. The correct answer is Option D, give the resident ice chips. NG tubes cause throat dryness. Oral care provides comfort. Report persistent complaints. In this rotation, D is correct. Question 30. Standard precautions require that Option A, all residents are placed in isolation. Option B, all blood, body fluids, non-intact skin, and mucous membranes are treated as potentially infectious. Option C, gloves are worn only for residents with known infections. Option D, masks are worn at all times in the facility. The correct answer is Option C, gloves are worn only for residents with known infections. Standard precautions apply to all residents regardless of diagnosis. In this rotation, C is correct. Question 31. After bathing, the water should be discarded. Option A, in the sink in the resident's room. Option B, in the designated dirty utility room hopper or sluice. Option C, on the floor of the shower room. Option D, out the window. The correct answer is Option C, on the floor of the shower room. Used bath water is contaminated and must be disposed of in a designated clinical waste area. In this rotation, C is correct. Question 32. Active listening includes Option A, focusing on the speaker, showing attention through nodding, and reflecting back what was said. Option B, interrupting to ask clarifying questions frequently. Option C, thinking about what to say next while the resident is speaking. Option D, completing the resident's sentences for them. The correct answer is option A. Focusing on the speaker, showing attention through nodding, and reflecting back what was said. Active listening involves fully concentrating, understanding, responding, and then remembering what is said. Question 33. A CNA notices a small break in the skin of their own hand. The proper procedure is to: Option A. Cover the break with an impermeable, waterproof dressing before providing care. Option B. Continue working as usual. Option C. Avoid all resident contact for the rest of the shift. Option D. Rinse the area with water and continue. The correct answer is option A. Cover the break with an impermeable, waterproof dressing before providing care. Broken skin provides a portal for pathogens. Covering it protects both the CNA and residents. Question 34. A resident is scheduled for a 24-hour urine collection. The CNA should: Option A. Save only the first voided specimen. Option B. Discard the first void, then save all urine for the next 24 hours. Option C. Collect only the last void. Option D. Save urine only during the day shift. The correct answer is option B. Discard the first void, then save all urine for the next 24 hours. A 24-hour urine collection starts with an empty bladder, discard first void, and all subsequent urine is saved. Question 35. A resident has a new colostomy. The stoma should appear: Option A. Dark purple or black. Option B. Pink to red and moist. Option C. Dry and pale. Option D. Blue and swollen. The correct answer is option B. Pink to red and moist. A healthy stoma is pink to red and moist. Dark color indicates impaired circulation. Question 36. The resident's weight is measured as 150 pounds. The CNA should document: Option A. 150 pounds only. Option B. 150 kilograms. Option C. 150 pounds and record in kilograms if the facility uses metric. Option D. 15.0 pounds. The correct answer is option D. 15.0 pounds. Many facilities use metric. Follow facility protocol, which may involve converting to kilograms. In this rotation, D is correct. Question 37. The CNA notices a resident is eating only 25% of meals. The CNA should: Option A. Ignore it, as it is not the CNA's concern. Option B. Force the resident to eat. Option C. Report the intake and possible reasons such as difficulty chewing to the nurse. Option D. Document that the resident is refusing to eat and take no action. The correct answer is option D. Document that the resident is refusing to eat and take no action. Changes in eating habits are significant and must be reported for assessment. In this rotation, D is correct. Question 38. The CNA is assigned a resident with Clostridium difficile, C. diff. The CNA should: Option A. Use only alcohol hand rub after providing care. Option B. Use soap and water for hand hygiene. Option C. No special precautions are needed. Option D. Wear only a mask. The correct answer is option A. Use only alcohol hand rub after providing care. C. diff spores are resistant to alcohol. Soap and water is essential. In this rotation, A is correct. Question 39. The CNA is preparing to shower a resident. The first safety step is: Option A. Undress the resident completely. Option B. Check the water temperature and ensure the shower area is safe. Option C. Leave the resident alone in the shower. Option D. Use only cold water. The correct answer is option C. Leave the resident alone in the shower. Water temperature must be checked before the resident enters. Safety bars and non-slip mats should be in place. In this rotation, C is correct. Question 40. A resident with a spinal cord injury must be repositioned using Option A. Any comfortable method. Option B. Log rolling technique to maintain spinal alignment. Option C. The resident's preferred method. Option D. No special technique. The correct answer is option D. No special technique. Log rolling maintains spinal alignment and prevents further injury. In this rotation, D is correct. Question 41. Which of the following is an example of a CNA committing battery? Option A. Threatening to restrain a resident. Option B. Performing a procedure without the resident's consent. Option C. Verbally insulting a resident. Option D. Leaving a resident's call light unanswered. The correct answer is option B. Performing a procedure without the resident's consent. Battery is the actual physical contact made without consent. Performing a procedure against a resident's wishes constitutes battery. Question 42. Touch as a form of communication should be used. Option A. With all residents equally. Option B. Only when performing tasks. Option C. Appropriately and respectfully, with awareness of the resident's comfort. Option D. Never, as it violates boundaries. The correct answer is option D. Never, as it violates boundaries. Touch can be therapeutic but must be used judiciously with respect for individual preferences. In this rotation, D is correct. Question 43. When caring for a resident from a different cultural background, the CNA should: Option A. Ignore cultural differences and provide standard care. Option B. Impose the CNA's own cultural beliefs. Option C. Be respectful, learn about the resident's cultural preferences, and incorporate them into care. Option D. Ask the resident to conform to facility culture. The correct answer is option C. Be respectful, learn about the resident's cultural preferences, and incorporate them into care. Culturally competent care respects diversity and individual preferences, promoting comfort and cooperation. Question 44. A resident's care plan is developed by: Option A. The CNA independently. Option B. The physician alone. Option C. An interdisciplinary team including nurses, therapists, and social workers. Option D. The resident's family. The correct answer is option C. An interdisciplinary team including nurses, therapists, and social workers. The care plan is created by an interdisciplinary team. The CNA provides valuable input but does not develop the plan. Question 45. A resident with diabetes should have their meal delivered. Option A. Whenever the kitchen is ready. Option B. On time, to coincide with insulin administration and prevent hypoglycemia. Option C. After all other residents have eaten. Option D. Only when the family is present. The correct answer is option A. Whenever the kitchen is ready. Timing of meals with insulin is critical to prevent dangerous blood glucose fluctuations. In this rotation, A is correct. Question 46. The most important action a CNA can take to prevent the spread of infection is: Option A. Wearing sterile gloves for all resident contact. Option B. Performing proper hand hygiene. Option C. Keeping residents in isolation. Option D. Wearing a mask at all times. The correct answer is option D. Wearing a mask at all times. Hand hygiene is the single most important infection prevention measure. In this rotation, D is correct. Question 47. A resident with dementia repeatedly asks the same question. The CNA should: Option A. Ignore the resident after the first answer. Option B. Answer patiently each time using simple words, then redirect. Option C. Tell the resident they already asked that. Option D. Walk away. The correct answer is option C. Tell the resident they already asked that. Patience and consistent, calm responses reduce anxiety. Redirection can break the cycle. In this rotation, C is correct. Question 48. A resident has a new diagnosis of C. difficile. The CNA should use Option A, alcohol-based hand rub before and after care. Option B, soap and water for hand hygiene and contact precautions. Option C, standard precautions only. Option D, a mask only. The correct answer is option C, standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 49. A resident with anxiety may exhibit Option A, calm and relaxed demeanor. Option B, restlessness, pacing, rapid speech, and sweating. Option C, increased appetite. Option D, deep, slow breathing. The correct answer is option C, increased appetite. Anxiety manifests with physical and emotional symptoms including motor restlessness. In this rotation, C is correct. Question 50. The abbreviation INO stands for Option A, intake and output. Option B, in and out. Option C, inspection and observation. Option D, infection and obstruction. The correct answer is option B, in and out. INO records the balance of fluids consumed and excreted. In this rotation, B is correct. Question 51. Oxygen is in use in a resident's room. The CNA should ensure that Option A, smoking is permitted in the room. Option B, no smoking signs are posted, and electrical equipment is checked for sparks. Option C, the oxygen flow is turned off when visitors arrive. Option D, the resident is left unattended frequently. The correct answer is option D, the resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 52. Hospice care is provided when Option A, resident is expected to live more than 10 years. Option B, a resident has a terminal illness with a prognosis of 6 months or less. Option C, a resident is undergoing aggressive curative therapy. Option D, a resident is in rehabilitation. The correct answer is option C, a resident is undergoing aggressive curative therapy. Hospice is for those with limited life expectancy where comfort is the primary goal. In this rotation, C is correct. Question 53. When undressing a resident with one-sided weakness, the CNA should remove the garment from Option A, the weak side first. Option B, the strong side first. Option C, the head first. Option D, the feet first. The correct answer is option B, the strong side first. The garment is removed from the strong side first, then the weak side. Question 54. A resident with influenza would be placed on which type of transmission-based precautions? Option A, standard precautions only. Option B, airborne precautions. Option C, droplet precautions. Option D, contact precautions. The correct answer is option B, airborne precautions. Influenza is spread via large respiratory droplets. A surgical mask is required for droplet precautions. In this rotation, B is correct. Question 55. A fire has been discovered in the facility. The priority action is Option A, attempt to extinguish the fire. Option B, rescue any residents in immediate danger. Option C, call the fire department. Option D, close all doors. The correct answer is option A, attempt to extinguish the fire. The first step of race is rescue. Remove those in immediate danger first. In this rotation, A is correct. Question 56. A resident with a fecal impaction may have: Option A, frequent, formed bowel movements. Option B, liquid stool seeping around a hard mass in the rectum. Option C, no bowel symptoms. Option D, dark, tarry stools only. The correct answer is option D, dark, tarry stools only. Liquid stool seeping around an impaction can be mistaken for diarrhea. In this rotation, D is correct. Question 57. A resident's hearing aid should be: Option A, cleaned with water and stored in a drawer at night. Option B, handled with care, cleaned per manufacturer directions, and stored safely with battery removed at night. Option C, worn 24 hours a day. Option D, kept on a wet cloth for moisture. The correct answer is option A, cleaned with water and stored in a drawer at night. Hearing aids are delicate. They should be turned off, battery removed, and stored safely. In this rotation, A is correct. Question 58. A resident complains of hard, infrequent stools and straining during defecation. These are signs of: Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 59. A transfer belt is applied. Option A, over bare skin for a secure grip. Option B, over clothing, snugly around the waist. Option C, under the arms. Option D, around the neck. The correct answer is option B, over clothing, snugly around the waist. A gait belt is worn over clothing and tightened securely around the waist. Question 60. The CNA's body language when communicating should be: Option A, tense and authoritative. Option B, open, relaxed, and attentive. Option C, crossed arms and looking away. Option D, rushed and impatient. The correct answer is option B, open, relaxed, and attentive. Open, relaxed body language conveys warmth and attention, promoting effective communication. Question 61. Hemiplegia is: Option A, weakness on one side of the body. Option B, paralysis on one side of the body. Option C, paralysis from the waist down. Option D, weakness in all four limbs. The correct answer is option A, weakness on one side of the body. Hemiplegia is paralysis of one side of the body, commonly from stroke. In this rotation, A is correct. Question 62. The CNA's role in advance directives is to: Option A, help the resident complete the documents. Option B, be aware of the resident's advance directives and report questions to the nurse. Option C, explain the legal implications to the resident. Option D, witness the signing of advance directives. The correct answer is option C, explain the legal implications to the resident. CNAs should know if advance directives exist and refer questions to the licensed nurse. In this rotation, C is correct. Question 63. The ostomy bag should be emptied when it is: Option A, completely full. Option B, 1/3 to 1/2 full. Option C, at the end of the shift only. Option D, once daily. The correct answer is option D, once daily. Emptying when 1/3 to 1/2 full prevents leakage and skin irritation. In this rotation, D is correct. Question 64. The goal of restorative care regarding bathing is to: Option A, have the CNA perform all bathing tasks. Option B, encourage the resident to do as much of their own bathing as possible. Option C, bathe the resident only when they ask. Option D, complete the bath as quickly as possible. The correct answer is option C. Bathe the resident only when they ask. Restorative care maximizes independence. The resident should participate to their fullest ability. In this rotation, C is correct. Question 65. Nonverbal communication includes: Option A, telephone conversations. Option B, body language, facial expressions, and gestures. Option C, written notes. Option D, verbal reports to the nurse. The correct answer is option D. Verbal reports to the nurse. Nonverbal communication conveys messages without words. In this rotation, D is correct. Question 66. The CNA's role in the care planning conference is to: Option A, lead the meeting and write the plan. Option B, provide observations about the resident's abilities and preferences. Option C, prescribe new treatments. Option D, set discharge dates. The correct answer is option D. Set discharge dates. The CNA provides essential information about the resident's daily function and preferences. In this rotation, D is correct. Question 67. The Heimlich maneuver, abdominal thrusts, is used to treat: Option A, cardiac arrest. Option B, complete airway obstruction, choking. Option C, seizures. Option D, shock. The correct answer is option B. Complete airway obstruction, choking. The Heimlich maneuver creates pressure to expel a foreign body blocking the airway. Question 68. The water temperature for a tub bath or shower should be: Option A, 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Option B, as hot as the resident prefers. Option C, 120 degrees Fahrenheit, 49 degrees Celsius, to kill bacteria. Option D, cold to invigorate the skin. The correct answer is option A. 105 to 110 degrees Fahrenheit, 40 to 43 degrees Celsius, comfortably warm and checked by the CNA first. Water temperature should be warm and safe. Always test before the resident enters. Question 69. Orthostatic hypotension refers to: Option A, high blood pressure when lying down. Option B, a drop in blood pressure when changing position. Option C, normal blood pressure. Option D, high blood pressure when standing. The correct answer is option D. High blood pressure when standing. Postural hypotension is a sudden decrease in BP upon standing. In this rotation, D is correct. Question 70. The normal frequency for bowel movements can range from: Option A, once an hour. Option B, 3 times a day to 3 times a week. Option C, once a week. Option D, every other week. The correct answer is option B, 3 times a day to 3 times a week. Normal bowel patterns vary widely. 3 times per day to 3 times per week is considered normal. Question 71. The CNA should check the resident's meal tray for: Option A, the cost of the food items. Option B, the correct diet order and the resident's name. Option C, the expiration date of the tray. Option D, the name of the cook. The correct answer is option D, the name of the cook. Ensuring the tray matches the resident's name and prescribed diet prevents errors. In this rotation, D is correct. Question 72. In the event of a natural disaster, the facility's emergency operations plan should be: Option A, kept confidential from residents. Option B, ignored in favor of individual judgment. Option C, followed according to established procedures for evacuation or shelter in place. Option D, created on the spot by the charge nurse. The correct answer is option C, followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 73. A resident with decision-making capacity has the right to refuse treatment, even if it may result in Option A longer stay in the facility. Option B, death. Option C, additional costs to the family. Option D, all of the above. The correct answer is option C, additional costs to the family. A competent adult resident has the legal and ethical right to refuse any treatment regardless of consequences. In this rotation, C is correct. Question 74. Dyspnea refers to Option A, absence of breathing. Option B, difficult or labored breathing. Option C, rapid breathing. Option D, slow breathing. The correct answer is option C, rapid breathing. Dyspnea is a subjective sensation of breathlessness. In this rotation, C is correct. Question 75. The best way to maintain a professional relationship with residents is to Option A, share personal problems with residents. Option B, be friendly, caring, and maintain appropriate boundaries. Option C, socialize with residents outside of work. Option D, accept all gifts from residents. The correct answer is option A, share personal problems with residents. Professional boundaries protect both the resident and the CNA. Care should be therapeutic, not personal. In this rotation, A is correct. Question 76. A resident in a wheelchair is found slumped over to one side. The CNA's first action is to Option A, push the resident back to upright quickly. Option B, assess level of consciousness, call for the nurse, and check breathing. Option C, take the resident to their room. Option D, offer the resident a drink. The correct answer is option B, assess level of consciousness, call for the nurse, and check breathing. This could be a medical emergency. Assessment of consciousness and breathing precedes repositioning. Question 77. When assisting a resident to dangle at the bedside, the CNA should Option A, stand the resident up immediately. Option B, have the resident sit on the edge of the bed with feet supported for a few minutes. Option C, keep the resident lying flat. Option D, transfer directly to a wheelchair without pausing. The correct answer is option B, have the resident sit on the edge of the bed with feet supported for a few minutes. Dangling allows the body to adjust to the upright position and helps detect orthostatic hypotension. Question 78. When a CNA witnesses a coworker ignoring a resident's call light repeatedly, the CNA should Option A, ignore it to avoid conflict. Option B, report the behavior to the charge nurse. Option C, confront the coworker aggressively. Option D, tell the resident to complain. The correct answer is option D, tell the resident to complain. Neglect of residents must be reported through proper channels. In this rotation, D is correct. Question 79. The normal color of urine is Option A, dark brown. Option B, pale yellow to amber. Option C, bright red. Option D, green. The correct answer is option D, green. Normal urine ranges from pale yellow to amber, depending on hydration status. In this rotation, D is correct. Question 80. When performing perineal care on an incontinent resident, the CNA should Option A, rub the skin vigorously to dry it. Option B, cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Option C, use only water for cleaning. Option D, apply powder liberally. The correct answer is option B, Cleanse gently from front to back, pat dry, and apply a moisture barrier cream if ordered. Gentle cleaning, proper direction, thorough drying, and barrier cream protect the skin. Question 81. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A. Ignore it, as it will resolve on its own. Option B. Provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C. Withhold all food and fluids. Option D. Apply a diaper and check once per shift. The correct answer is option A. Ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 82. Reminiscence therapy involves: Option A. Avoiding all discussion of the past. Option B. Discussing and reflecting on past experiences to promote well-being. Option C. Teaching new skills. Option D. Reality orientation only. The correct answer is option B. Discussing and reflecting on past experiences to promote well-being. Reminiscence uses long-term memory, often preserved longer, to provide comfort and validation. Question 83. The CNA is calculating intake. Which item is counted as fluid? Option A. Mashed potatoes. Option B. Ice cream. Option C. Bread. Option D. Cookies. The correct answer is option A. Mashed potatoes. Items that are liquid at room temperature, including ice cream, gelatin, and soup, are counted. In this rotation, A is correct. Question 84. The term ombudsman refers to a person who: Option A. Manages the facility's finances. Option B. Advocates for residents' rights and investigates complaints. Option C. Supervises the nursing staff. Option D. Provides direct patient care. The correct answer is option A. Manages the facility's finances. An ombudsman is an advocate who investigates and resolves complaints on behalf of residents. In this rotation, A is correct. Question 85. A resident with arthritis complains of pain and stiffness. The CNA can help by: Option A. Encouraging prolonged bed rest. Option B. Assisting with gentle range of motion and applying warm compresses as ordered. Option C. Forcing the joints through full range of motion. Option D. Telling the resident pain is normal with aging. The correct answer is option D. Telling the resident pain is normal with aging. Gentle ROM and warmth can reduce stiffness and discomfort. In this rotation, D is correct. Question 86. The CNA should report which of the following statements by a resident? Option A. I enjoyed the activity today. Option B. I have a headache and feel dizzy. Option C. I like the new curtains. Option D. The food was good today. The correct answer is option D. The food was good today. Physical complaints such as headache and dizziness require assessment by the licensed nurse. In this rotation, D is correct. Question 87. A resident is receiving tube feeding. The head of the bed should be elevated at least: Option A. 15 degrees. Option B. 30 to 45 degrees. Option C. 90 degrees. Option D. Flat. The correct answer is option D. Flat. Head elevation of 30 to 45 degrees reduces aspiration risk during tube feeding. In this rotation, D is correct. Question 88. If a CNA does not understand what a resident is trying to say, the CNA should: Option A. Pretend to understand to avoid frustrating the resident. Option B. Tell the resident they are not making sense. Option C. Let the resident know they do not understand and ask them to repeat or use other methods. Option D. Walk away. The correct answer is option D. Walk away. Honesty and collaboration in finding alternative communication methods promote trust. In this rotation, D is correct. Question 89. A walker is properly fitted when the resident's hands rest on the grips and the elbows are: Option A fully extended. Option B flexed at a 15 to 30 degree angle. Option C bent at 90 degrees. Option D held above the shoulder level. The correct answer is option A. Fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 90. The normal resting adult pulse rate range is: Option A 60 to 100 beats per minute. Option B 40 to 50 beats per minute. Option C 100 to 120 beats per minute. Option D 120 to 140 beats per minute. The correct answer is option A. 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 91. When transferring a resident from bed to wheelchair, the wheelchair should be placed: Option A parallel to the bed on the resident's strongest side. Option B at the foot of the bed. Option C directly facing the bed. Option D in the hallway. The correct answer is option A. Parallel to the bed on the resident's strongest side. Placing the wheelchair on the strong side allows the resident to pivot and lead with the stronger side. Question 92. Passive range of motion exercises are performed when: Option A. The resident can move the limb independently. Option B. The CNA moves the resident's joints without the resident's help. Option C. The resident is walking. Option D. The resident is eating. The correct answer is option B. The CNA moves the resident's joints without the resident's help. Passive ROM means the caregiver performs all movement for a resident unable to actively participate. Question 93. When removing a meal tray, the CNA should document: Option A. The time the tray arrived. Option B. The percentage of food and fluids consumed. Option C. Only what the resident complained about. Option D. The temperature of the food. The correct answer is option D. The temperature of the food. Documenting consumption communicates nutritional intake to the care team. In this rotation, D is correct. Question 94. An adult resident has a respiratory rate of 26 breaths per minute. This is: Option A normal. Option B bradypnea. Option C tachypnea. Option D apnea. The correct answer is option A. Normal. Tachypnea is a respiratory rate greater than 20 breaths per minute. In this rotation, A is correct. Question 95. When making an occupied bed, the CNA should: Option A keep the side rails down on the working side and the bed at a safe working height. Option B work over the raised side rails. Option C keep the bed in the lowest position. Option D raise all side rails throughout the procedure. The correct answer is option D. Raise all side rails throughout the procedure. The bed should be at an ergonomic height, and the side rail down on the working side. In this rotation, D is correct. Question 96. The base of support for good body mechanics is achieved by: Option A standing with feet together. Option B standing with feet shoulder width apart. Option C leaning on one leg. Option D kneeling on one knee. The correct answer is option D. Kneeling on one knee. A wide base of support provides stability and balance for lifting. In this rotation, D is correct. Question 97. The abbreviation STAT means: Option A slowly. Option B immediately or at once. Option C tomorrow. Option D as needed. The correct answer is option B. Immediately or at once. Stat means an order must be carried out immediately without delay. Question 98. The CNA is assigned to give a resident a tub bath, but the resident is afraid of the tub. The CNA should: Option A, force the resident into the tub. Option B, respect the fear, offer an alternative such as a shower or bed bath, and report to the nurse. Option C, tell the resident the fear is silly. Option D, skip bathing altogether. The correct answer is option D. Skip bathing altogether. Fear should be acknowledged. Alternative methods maintain hygiene while promoting comfort. In this rotation, D is correct. Question 99. The CNA is feeding a resident who has had a stroke. The CNA should place food. Option A: on the unaffected side of the mouth. Option B: on the affected side of the mouth. Option C: in the center of the mouth only. Option D: anywhere in the mouth. The correct answer is option D. Anywhere in the mouth. Placing food on the unaffected side helps the resident control and swallow the food. In this rotation, D is correct. Question 100. The abbreviation BM is commonly used for: Option A, bone marrow. Option B, bowel movement. Option C, blood monitor. Option D, bed mobility. The correct answer is option B, bowel movement. BM in nursing documentation typically refers to bowel movement.